Good afternoon, everyone. Thanks for logging on. We're going to take a few more minutes to allow others to join, and then we'll get started.
Well, good afternoon. It is indeed my pleasure to welcome you all to our 26th webinar in the Coffee with webinar series, sponsored by the Greenleaf Center for Servant Leadership at Seton Hall University. I'm Reggie Lewis, the center's executive director, and it's great to greet you all who've logged on today from places around the U.S. and abroad to take part in our conversation with the Joe Patrnchak, a leading voice in the world of human resources, talent development, and impactful leadership. Of course, Joe is a returning guest on our webinar series. This one in particular is one of our more popular sessions where we unpack challenges surrounding the hard work, the difficult work of transforming organizational culture. So you're all in for a treat. And in a minute, I'll do a formal intro on Joe. But you should know that the Coffee With series provides the center with the chance to showcase the inspirational stories of servant leaders and the endless ways in which individuals, organizations, and society in general can be transformed by the power of servant leadership, a philosophy in which the leader first seeks to serve. And I assure you today that Joe will not disappoint. A quick word about other programs at the center. For nearly 60 years, the Greenleaf Center has worked to promote the awareness, understanding, and practice of servant leadership. In addition to the Coffee With series, other core programs include the annual Public Policy Lecture, which features thought leaders and issue experts from a range of sectors who apply a servant leader's perspective to current policy challenges. The Greenleaf Scholars Program, which funds researchers who promote work and research around the efficacy and impact of servant leadership. The center also exposes high school and college students to opportunities to develop lives of service through our Next Generation initiative. And through our outside engagements, we proudly work very closely with organizational partners as they implement the practice of servant leadership throughout their workplace culture. Now, the moment we've all been waiting for. It is indeed my honor to formally introduce and welcome back today's guest, Joseph M. Patrnchak. Since 2014, Joe has been the head of Green Summit Partners, LLC, a prestigious consulting practice dedicated to helping organizations to bring out their best in people. Joe brings a wealth of experience to this role. Prior to establishing Green Summit, he served as the Chief Human Resources Officer at the Cleveland Clinic, helping to create a culture in which all staff are considered caregivers, and we're going to really dive into that today. Joe essentially led a process of transforming the workplace of one of the largest medical facilities in the world to one in which everyone is expected to deliver passionate care, regardless of their title or position at the hospital. That could be receptionists, technicians, housekeeping staff, nurses, and certainly doctors. This work has been recognized at the local, regional, and national level. Before joining the Cleveland Clinic in 2007, Joe served as Chief HR Officer and Senior Vice President at Blue Cross Blue Shield of Massachusetts. He also served as a Vice President of Human Resources for HP Compact Digital, where he led HR for the $4.5 billion Global Customer Services Division. A scholar athlete, Joe holds a BA in sociology from Northwestern. He holds a Master of Science in Human Resources Management and Organizational Development from American University. And he's a graduate of the Advanced Executive Program at Northwestern's Kellogg School and the International Management Program at INSEAD Fontainebleau, France. Joe made me practice that a few times. And he's the author of many books on HR and servant leadership. Joe remains among the more prominent thought leaders on these subjects today. But of all the designations, we at the Center are most proud of his role as a past chair of the Board of Trustees for the Center for Servant Leadership here at Seton Hall University. Okay, Joe, are you ready? Have you got a mug on your end with some good Vermont coffee? I'm going to get that camera on for you. There you go. All right, all right. Some a Joe mug with some Joe stuff in it. All right, it's so good to have you with us today. Welcome back. Welcome back.
Good to be here.
We
And who was that guy you introduced?
yeah, I've told some folk here on campus that for a very small nominal fee, some autographs might be available, some memorabilia. But today is a really exciting topic for us because clearly you did some amazing work at the Cleveland Clinic. It is certainly one of our stories about organizational transformation that we share with our organizational partners. You're one of the few who can talk about actually doing this and doing it at a massive scale. So we're going to use the Cleveland Clinic, if you will, today to help people to understand some of the strategies and the mechanics that you leverage to achieve this great work. And we thought it was important to give folks some context. And so I don't think many people fully understand just how large the Cleveland Clinic is. So I know Gabby has a slide. If Joe, if you could just say a bit about the magnitude and the massive scale of the clinic, particularly when you think about the global footprint that's been established for this organization.
Yeah. The Cleveland Clinic is really a healthcare system that really stretches across the world. On the main campus, itself in Cleveland is 29,000 people just in there. Then the organization is frankly is grown quite a bit larger than 43,000 people. I think it's closer to almost 55,000 to 60,000 people now. There are a number of other regional hospitals that have been acquired through the years to help, really to save the community hospitals. Most of them cannot survive unless they have some support. But it's a large organization, multi-billion-dollar operations in Abu Dhabi and Dubai and Miami. And the physicians, one of the things that makes the Cleveland Clinic unique is that the physicians are employees. They're not contractors, as in a lot of hospitals. So there are over 3,000 physicians and scientists that are actually employees of the Cleveland Clinic. So it's a world-renowned organization. It's always in the top 5, 4 or 5 of according to U.S. News and World Report. So it's a great organization. It's one that, as the CEO once said, that we have the highest acuity level of any hospital in the world. In other words, the sickest people in the world come here. 99% of them come home, but they don't like us very much. Okay, and so this is why we hired you, Joe. Okay, to help us with that.
And indeed you did. And certainly in 2007, when you joined the clinic, it was within or ranked among the top 4, drawing patients from our research has it that the clinic was drawing patients from over 100 countries from around the world. But you were stepping into, yes, a high performing organization. And with stats like that, rankings like that, it was easy to sort of mask 2 other realities happening at the place. One had to do with employees who weren't always very happy about their environment, not the most engaged. And then to your point about the CEO's comments about the environment with respect to patient care, patient satisfaction rankings that were below average. Can you share a bit more with our audience about those 2 realities? You can have these wonderful rankings, a world-class medical facility, yet a lot of people working in a place like that who weren't happy, and certainly patients who they went home healthier, but they weren't always happy about the patient care.
Yeah. There's been a lot of research done on this, okay, that actually the patient care improves when the employees feel better about the environment, okay, because they pass that on to their patients. But one of the challenges that we had was that the government was now measuring not only the patient satisfaction, but the employee satisfaction. Okay. And reimbursements were being determined by the reputation of hospitals. And so what happened was all this was posted on the internet. So what happened was consumerism got involved with the healthcare system. And of course, when we consumers get involved in anything, we just ruin everything, okay? Because we want the best of everything, right? So the actual patient experience is driven by the employee experience. Okay, and if someone could ever figure out a way to deliver a great customer experience or patient experience with a disengaged workforce, you could probably publish a book and make a lot of money. Okay. But it just doesn't happen. Okay. And so, but you don't need an employee survey to tell you whether or not you have an engaged workforce or not. You can walk around. Walter Hewitt from Hewlett Packard was famous for this. There's a term managing by walking around, which I did when I first joined the hospital. I would come in on Saturdays just to meet some of them weekender staff and sit in the cafeteria and just talk with people. And I would ask one question, what's keeping you up at night? It's amazing what you can learn by that one question. There's a lot of stories that I could tell about what I learned. I can recall one story. Frank, it was a weekender nurse. He goes, "You're that new HR guy, right?" And I go, "Yeah, that's right." He goes, and we both had cafeteria trays in our hands, so we couldn't shake hands, And I said, he says, "Joe, can I ask you a question?" He goes, "Yeah, what is it?" He goes, "Well, I'm a weekender nurse, and I get paid an extra couple of dollars an hour to work 12-hour shifts on the weekend, but I get my vacation docked. Can you tell me why that is? I've been trying to get an answer to that, but I don't expect it to change. Okay, but could someone just respect me with an answer?" So the next Monday, I went to our chief nursing officer and asked her the question, and she said, "Well, we try to normalize the cost. Okay, so we dock them on their vacation time."
Right? Oh gosh.
I said, "Well, are you still having trouble getting weekender nurses?" "Oh, terrible." I said, "Well,
gosh."
So it was changed, and I took Frank's card and I called him. I said, "Frank, we're going to change the policy, but I just want you, that I want you to tell your friends that you're the guy that changed it." And so whenever I saw him in the weekends, that we always found a way to shake hands, even with trays in our hands.
Look at that. And so in addition to talking to Frank and talking to others as a part of your sort of informal listening tour, you did something quite bold. You commissioned a Gallup survey, and you help key decision makers to take a hard look at not just insights coming back from these sort of weekend conversations, but anonymous data, powerful survey data. Talk about that process of commissioning Gallup, but also more critically, how you were able to nudge key decision makers in that leadership team who were not as moved and eager to do something about that data.
Yeah, it was the first Gallup survey, engagement survey that was done at the Cleveland Clinic. So it had never been done before. And the Cleveland Clinic, these are doctors and they're scientists, and they want to see data. And so our scores did not come back we were in the bottom 44th percentile. And it only showed that 38% of the people were committed to the mission of the organization. Now,
only 38%?
Only 38%.
Wow.
And now I worked 25 years in the computer industry. I didn't see too many people die from hooking up or installing computers, but in hospitals,
right.
If people aren't committed to the mission, people can die.
Yeah.
Okay. And so this was very alarming. But even with the data showing this, we had a lot of people that didn't believe the data. So, I mean, when the data doesn't come back the way you'd like it, what do? You refute the data. So it wasn't until the HCAP scores became important, the patient experience scores became important.
Can you just help our audience to? Yeah. I'm not going to make you talk about each of the letters for the acronym, but say a bit about the HCAP scores.
Yeah, so the government, every hospital that takes federal funds, which most do, have to measure the patient experience, and the government, actually, the U.S. government, they're the ones that survey, not the hospital. So you get an independent viewpoint on the patient experience, and they actually base their reimbursements on that. And of course, the CEO who hired me knew this was coming and felt like this was a dimension of the hospital's experience that wasn't as strong as it needed to be. And so he felt like somebody, an HR officer coming from an environment where the customer experience was very important, and there was a culture built around a customer experience, that the person in that role could play a significant role in changing the culture to help build that. And so it was quite alarming. Some of the data that we initially found out is like, that one slide you showed is like, it takes four actively engaged people just to neutralize one actively disengaged person. And
Wow.
our first after our first survey, we weren't clicking close to 4-1. We were 2.8 to 1.
Gabby, put that up again for our audience to see that, the engagement slide there. Engagement. There you go.
So you can see that we were far below the neutral in that blue box. But after we built our cultural development plan and executed over a period of 7 years, that ratio rose to 9.6 to 1. And frankly, our patient experience scores map right along with that.
Okay. And we're gonna give our audience a much nicer, you can pull that down, Gabby, much nicer graph I know that you'll appreciate, Joe, which helps to capture the evidence of your good work in a minute. But say a bit about this whole notion of resistance, because a lot of our practitioners confront that. People, they can see the data, they can see the evidence, but this whole notion of forcing people out of their comfort zones can be quite challenging. And also, if we were to sort of play devil's advocate, one might say to you, my dear friend Joe, well, what's wrong with having the doctor do some command and control when he's operating on me? Like I I think that they may have a point, in terms of, clinical leadership, ruling the day. What do you say to all that? What did you say to all your colleagues at the time who were pushing back from that standpoint? Hey, what do we lose in trying to do this fuzzy thing called servant leadership?
Well, there are situations where a command and control is the right leadership model. If anybody on this call has been in the military, I mean, you learn how to follow orders, or people can die. I played 4 years of Big Ten football at Northwestern, and when a coach called a play, you didn't do consensus management in the huddle. Okay, you kind of ran the play, lined up and ran the play. All right. But if it's the only form of leadership you're using, it shuts people down.
Mm.
It creates fear.
Mm.
And when people are fearful, and they're not going to give you their creativity, because God forbid if you make a decision on your own, you use your own judgment, and that judgment is different than the command and control leader. Okay, they're going to play the blame game. So if it's the only form of leadership you're using, it can create a negative environment. And now many of the great service organizations in the world use some form of servant leadership, as we all know. And it's not just a nice thing to do. Servant leadership just gets better results. The good to great companies,
Yes.
they generated over 17.5% total return on investment. The servant-led companies, almost 28% return on investment. So it's not just a nice thing to do, it just gets better results.
Absolutely. And thank goodness you had a great CEO that you're able to convince and to support a new direction. Say something about that.
Well, he was one of the top heart doctors for 35 years, and he was a very command and control command and control type person. And so he wasn't easily convinced. But when I made my presentation to what I felt the culture needed, he listened. And he said, well, I hear this, I understand it, but I really need to believe it. So whatever you do, don't do a hard launch on servant leadership. Do a soft launch. Just go out and talk about servant leadership to as many groups as you can, right? And if there is some gravity around this, some pull for it, then we'll do a more formal launch and training and whatever, right? But I need to be convinced that this is the right model because there are other models out there, and as well. So we did a soft launch. I spoke to a lot of groups all over the company, all over the organization, and sure enough, there was a gravity and pull for this. And then we started a more formal process of launching it.
And this soft launch, if you will, almost like a sort of scaffolding to sort of ease people into this approach, was built around two concepts, mainly this whole notion of serving, leading competencies. And Gabby has a slide. We're not going to show it just yet, Gabby, but we're going to get into some of those mechanics, serving, leading competencies, but then also a mindset, a shift in mindset around we're all caregivers, whether, again, you're the person who's in, serving as a valet or a person in the dining hall, but certainly in the OR, we're all responsible for the patient care experience. Among those serving, leading competencies, there's one called empowerment and delegation. Say a little bit about that, because again, to your very good point, certain sort of life-saving situations or circumstances will necessitate some command and definite control. But if you only lead by fear, you stymie creativity. And then here comes Joe Patrnchak with this whole notion of consensus building, particularly empowerment and delegation. Say a bit about how you ease that environment into that direction.
Well, one of the keys to being a good servant leader is this idea of humility, meaning that you don't have all the answers. Now, command and control leaders, they really don't like to share power because, there's an attitude there that, hey, I'm the leader. I was hired because I know something, okay, and because I know something, I'm just going to execute and do it. Where the servant leader understands that there's more knowledge out there than just my knowledge. The people closest to the patient or closest to the customer, they know more about what's going on than I do as the leader, because they're dealing with it every day, and they understand the dynamics every day, and how those dynamics change. So this idea that the servant leader sharing power is a very, very important, and having some humility. That requires real humility to do that.
And then when you think about those people who are closest to patients, like the physician assistants and nurses, structurally, how were their voices? How did you create the kind of structure that would enable you, the CEO, and other decision makers to leverage their voices in what was happening in the organization?
Well, one of the things that you mentioned earlier was this idea that we're all caregivers. Now that didn't happen overnight. I spent a lot of time working with a cohort of people across the organization, and when I got to the Cleveland Clinic, I discovered that the way we refer to people who worked at the Cleveland Clinic, there was the professional staff and the non-professional staff, meaning the doctors or the non-doctors. Now, language is very important in any organization. It's filled with values and beliefs, and the CEO was very open. He goes, Joe, what do you see? You've been here 6 weeks. What do you see? I says, well, I'll tell you, this is the language here. I've never worked anywhere where there was a non-something that worked in the organization. Okay, right? We had teammates, we had colleagues, we had associates, but non-professional. I mean, how could you be committed to the mission? I mean, only 38% of people committed, and said there was no back off in a true service organization. There's no such thing as a back office job. Everybody's working in a front office job. Either they're in front of the patient or the customer, or they're interfacing with somebody else who is. Okay, and so that everybody has a role in creating a service experience. He says, well, he goes, what do you recommend? I said, well, I got a group of people together, and we decided that we should rename everybody and call each other caregivers. That became the norm. Now, just because you retitle somebody doesn't necessarily mean that it's going to stick. So we took 43,000 people at the time through a half-day workshop over a period of 9 months, talking about how we were all caregivers at the Cleveland Clinic, no matter what we did. And we had a learning map that allowed us to identify the touch points that every patient or family member has when they come into the Cleveland Clinic, and to talk about our mission and our values, which we had to change, by the way, as well, right? And get how all of us have a role in creating the whole patient experience.
Everybody has a role in contributing to the patient experience, and that's a nice segue into your larger people strategy and how you gradually pulled folk along. And that's one of the lessons that's already coming out of this conversation today. Change doesn't happen overnight. And so you took on an approach of a sort of gradual immersion versus a sort of shock and awe. Gabby has a slide with 6 major components as a part of this people strategy. Serving leader training, the cohorts you talked about, serving leadership in a box, and the servant leadership toolkit, serving leadership metrics. So, one of the things you often remind me about here is that you got to be able to measure where you're going and progress. That's key. If you could say something, Joe, about creating, this is bullet 5, that serving leadership community of practice, because at some point, thankfully, eventually, this took on. And as you helped us to realize as we prepare for today's session, one of the interesting things you learn is that there was actually a yearning for among employees to be more engaged, to be a part of something larger than themselves. So you co-created a community of practice. Say a bit more about that.
Well, the community of practice is something that is a term that's used in healthcare quite a bit. Okay, there's a community of practice around certain diseases, around certain medical procedures. Okay, there are institutes that are created built around a community practice, and so I felt like it was important to use some of the terminology that would be that people working in healthcare could recognize, and that's probably relevant for anybody's whatever organization that you're working is trying to use the same language that people will recognize in your particular industry, and you don't always have to introduce new language. So this was actually something that people could be familiar with. And so I said, well, why not create a community of practice around this idea of servant leadership, where people could get together and share some of their ideas, share some of their experiences, share some of their frustrations, things that didn't go well, all right, and learn from others where it was working. So this community of practice was something that was very relevant to to healthcare, but could be very relevant in any organization, really. Okay, it's just to get a group of people together that are practicing servant leadership of some sort. Get them together and talk about, and I found that people love to share their experiences. They don't necessarily like to share all their failures. Okay, right? That takes a safe spot to do that. But people will really enjoy talking about some of their successes. And so when we get people together and create a community of practice, these are some of the things that we're doing.
And then there is also the introduction on your part as head of HR on publicly recognizing the preferred behavior, if you will. Say something about that.
We the one of the things that goes on a lot in any organization, particularly in healthcare, is that you have a lot of meetings, sometimes too many meetings, right? But it's important to showcase people who are being successful. And this is where you have the sort of the tentacles of your organization out there, recognizing people who are doing something very well as a servant leader. And you want to take that person and showcase them, hold them up as an example, and have them be recognized in front of their peers. And have them stand up in a meeting and say, "Hey, look, this is somebody who is demonstrating servant leadership. Here's Mr. Lewis. Could you come up and talk about your experience as a servant leader and what successes that you're having doing that?" So the more you can showcase people and hold people up as an example, recognition is a very powerful tool.
And Joe, this recognition was shared across people throughout the organizational structure. So just not executives, but it could be someone in housekeeping or someone among the clinical staff.
Every caregiver, we made a conscious effort, okay, to make sure that every caregiver across the whole organization got recognized at some point.
Is this still going on today?
Yes, it's still going. Now, the whole idea, the Cleveland Clinic likes to patent their ideas, and so they, and so there's a lot of healthcare organizations that come in and benchmark what the Cleveland Clinic is doing, and so they've adopted this. They don't really call it servant leadership anymore. They call it the Cleveland Clinic leadership model.
Uh-huh.
Right. But all of the principles are still there. It's really a servant leader model.
Uh-huh. We're about to. I just want to remind our audience that you'll have an opportunity in about 2 minutes, as I'm getting text messages and reminders, to ask Joe a few questions. But I got to ask you, Joe. You came in 2007, and within really less than 5 years, you saw some major traction around this effort. I think we have a great graph looking at those two major indicators again that you were most concerned about in employee engagement, but also patient satisfaction. So from 2008 to 2013, significant improvement across these two areas. Say something about that, and if you would have done anything differently between 2008 and 2013.
Well, I'll start with
this is impressive. This is huge.
Yeah.
Keep that up for a second, Gak.
Yeah. Well, just a comment about this improvement. There's really a guiding principle here, right? Is that people are not going to start caring about the customer or not going to start caring about the patient until they feel cared for. And when I arrived at the Cleveland Clinic, people didn't feel cared for.
Right.
Right. The leadership model was a big thing to change the culture, but we also had to change a lot of the benefit structures as well. Right. That demonstrated that we cared for people. I could talk a lot about some defining moments that you have as a leader. And I had that within my first 6 months there. Okay. The retiree medical plan. Deloitte came in and did an audit, and they have a formula that one group of people cannot have a benefit that's a multiple higher than another. And ours was retiree medical. And I had to take this to the doctors had no retiree medical charge where everybody else did. All right. And so I thought, well, this is, I was told by some friends that, Joe, you're going to commit political suicide, okay, by raising this issue. And I said, well, we're not going to really change this culture until people start to be cared for. So this was a defining moment, and I may have to look for another job, but I can't. This really is against my value structure here, and I'm not going to leave right away, but I'll find another job first. Okay. So people are not going to. So this is all about. We started to really demonstrate, and people believed. They didn't trust, but we built belief in the system, and that we cared for them, and that was just one of the ways that we demonstrated it. And of course, the leadership model was another way. So this
and that belief sort of permeated throughout in such a ways. Again, looking at engagement from 2008 to 2013 and how it correlates with the HCAP ratings as well. Final comment on that before we open up to our audience.
Yeah. So we wound up the patient experience was in the average to below average at best when we first started this process. By the end of 2013 and 14, we're in the 90th percentile.
It's amazing. Amazing. Of course, Joe, we could talk all day, and one day soon we will. But I've got to shift this over to our brilliant young project manager who will lead us during the Q&A session for our audience, Gabby Cooper.
Thank you, Reggie, and thank you, Joe, for being here with us today. So we have a few questions that have come in anonymously in our Q&A feature. So the first one for today is, besides the experiences that you mentioned, what were some other times when you noticed disparities in the workplace where servant leadership needed to be implemented?
Well, as I mentioned, the Gallup survey was a big indicator. Mm-hmm. But if you're waiting for an engagement survey to show you some metrics, you're probably not doing your job as a leader. Right? Mm-hmm. And probably the most powerful observation you can have is managing by walking around and kind of eavesdropping, really. Okay, I hate to say that. Okay, but overhearing conversations and so there were multiple data points that I had, and I could go on and on about some stories as well. Okay, mm-hmm. Right. I can recall once, every month there would be a meeting at 7 o'clock in the morning. Okay, all right, with all the staff. Okay, and I was in an auditorium, and it's like most auditoriums, there's nobody sitting in the front rows. Everybody's in the back row. Mm-hmm. So,
I've always noticed that.
So I walk in, and I was really on a house hunting trip. Hadn't really started yet, right? Mm-hmm. And so I says, well, it looks like we don't have any assigned seats here today because, there's nobody sitting past this back row. I said, well, one of the doctors said, well, we should have assigned seats here because they treat us like children.
Wow.
Oh, there's a data point. Okay, all right.
It is.
So the light comes on, and Toby Cosgrove, the CEO, goes, "Oh, by the way, our new chief HR officer is here, Joe Patrnchak. If you see him, say hello." So the doctor turns to me and says, "Joe, hey, congratulations. Welcome to the Cleveland Clinic." He goes, "By the way, did I introduce myself to you?" And I said, "No." And he goes, "Great. Have a nice day." Okay. He got up and left, and I never saw him again. Okay. All right.
Mm.
So these are multiple data points. If you're waiting for a survey, you're probably not close enough to your people. And if you're close to your people and you have some humility and you ask, how could I improve things here? What barriers can I remove that is getting in your way? What's keeping you up at night? You'll hear a lot. And so there are just so many multiple data points that I could point to, but those are some of those.
Yeah, it's definitely about asking the right questions and listening to make those connections that will build up the environment. Okay, so our next question that came in was, you mentioned that it is important to convince others that servant leadership is the most successful model of leadership, especially in terms of results. Was there a time when you noticed other organizations in your field that could have benefited from servant leadership? And if so, how did you approach that?
Well, I was very fortunate in some of the past organizations that I worked in the computer industry. Uh, I kind of grew up with that service culture. So it was, and the services company in the computer industry I worked at was recognized as one of the best service companies in the world. Really, it was a huge organization, but had great service. And then I went to work at Blue Cross Blue Shield in Massachusetts, and they're very service oriented as well. So this was kind of in my DNA. And so I was very fortunate that way that I had the opportunity to work for some great service organizations and service companies. But at the end of the day, you need a model that people can relate to, because and this the model that we used at the Cleveland Clinic was around 5 actions. That was very specific. What does a servant leader do that's different than a command and control leader? What are the 5 actions that a servant leader does? Okay, right, and that was something tangible that people could hang their hat on and say, okay, now I understand.
Yeah, presenting something that people can relate to helps them latch on. So our next question is, can you speak about what you do in your current position at Green Summit? What are ways in which you utilize servant leadership, and how does the organization bring out the best in its people?
You know, one of the things that I did in my career was I went off and I was plateauing in my career at one point, and so what do you do when you kind of plateau a little bit? You go off to a retreat, right? you go off to some kind of, it was run by Stephen Covey, and he part of the exercise, and I don't remember one thing from this whole retreat. Okay, one thing, and it was very important to me. It was like, and he challenged everybody in the room. What is the one thing that you do better than anybody else in the world, or most people anyway? Okay, all right. Very few of us do anything better than anybody in the world. Okay, and I start and say that in 2 sentences or less. And I started to really think about that. I said, I started thinking about my experience as an athlete, as an executive, and how I brought a lot of other people along. And I said, well, geez, I think I'm in the right profession, okay? Because HR is supposed to bring out the best in people in organizations. And if we're not doing that, then we're probably not doing our job very well. So when I really discovered that, then I put my leadership pedal to the metal, so to speak, and I really start taking some risks and help to really challenge and bring the organizations along, right? So when I decided to move on to the second career that I have, I say, well, this is going to be my motto. Okay, Green Summit Partners is going to be dedicated to working with other people and other organizations to build strategic plans to help them bring out the best in their people and their organization. So that's kind of what I've been doing and dedicated to. And I work with a lot of nonprofits, quite frankly, because many nonprofits don't have the luxury of a lot of executive training and coaching. Okay, so I found myself working with a lot of nonprofits in this space, particularly with Green Summit Partners.
And the world is a better place because of that. Okay, so our next question is, so we all know that it's hard to stay the course when you're a part of creating institutional change, no matter where you are in your career. So during some of those days in which there was a lack of encouragement, some down thoughts, what kept you going?
Dissatisfaction. Frankly, no real change happens unless you have some real dissatisfaction. I mean, think about it in your personal life. You want to lose weight. You want to start working out more. You want to make a personal change. You're probably not going to get going on it real hard unless you have some personal dissatisfaction with your current state. Now, when things get tough and things get lonely, when you put yourself out there, one of the things that you can, and you get discouraged, one of the things that you can recall is that initial dissatisfaction that you had before you started the change. And remember that. Do you want to go back to that initial dissatisfaction that you had? And if the answer is, well, maybe not, but if the answer is no, I can't go back there. Okay, all right. That's a place where I can't be anymore. That dissatisfaction will be back, and I can't handle it. So one way that you can, and we all get discouraged. Let's face it. Okay, change is not easy. But if you can think back around that initial dissatisfaction that you had to start the change and relate to that, then chances are you'll continue down that path moving forward.
Yeah, the chances are that people don't want to go back to that dissatisfaction. So our last question, because of time, would be, what advice would you give to someone who is facing resistance to change in a workplace environment?
Well, first thing to understand is you will always have resistance. It's normal. People are resistant to change. We are resistant to change. And if we're a little naive and we think we're not going to have resistance, then we're being a little naive, okay, in the change process. We have to just accept the fact that when we start a change effort, the resistance is right around the corner. The resistance is right around the corner, so we have to expect it. But we have to be focused on the value of that change, and the value of that change has got to be perceived as being greater than the resistance that shows up. And when we stay focused on that value, it will help us move through the resistance, which will always be there. So I would just offer that as one thing to think about when that resistance does show up, and it will always will.
Well, thank you so much for taking the time to sit and chat with us today. Before everybody logs off, I have a few announcements about the Greenleaf Center. So our first announcement is that registration for our next Foundations of Servant Leadership course that starts on June 19th is now open. Registration information can be accessed through the QR code on the screen here, or you could find it linked to our homepage at greenleaf.org. Next, I would like to invite you to our next Coffee with webinar with Howard Bihar, a returning guest, who is the former president of Starbucks International. And he will be joining us to talk about the company's continued efforts to invest in its people and put people first. And our last announcement is a save the date for our third annual Hall of Fame, which will take place on October 16th, 2024. We would love to see you there. If you would like to stay connected with the Greenleaf Center, you could please use the QR codes on the screen to access our social media, follow the announcements we have and our upcoming events. And lastly, thank you everybody who logged on today. If you could please take a moment to complete the Zoom survey that will pop up after the webinar ends, we would greatly appreciate that. Thank you all so much, and thank you, Joe.
No, thank you for being a servant leader exemplar, for making the world a better place. And we hope to see you soon.
Thank you. Thank you for having me.
Thank you all for joining us. Please, as Gabby mentioned, complete those surveys and have a great Wednesday. Bye-bye.
Bye now.
Take care.